Hello everyone, in this video we are going to talk about internal genitalia or internal organs of reproduction in case of female. Now, when we talk about internal genitalia, we first should understand the concept as we should do in our every video or every learning. We should first understand the concept. I am repeating this thing each and every time. Okay, so what you expect from the internal organs of the female? You expect that it should do two basic things. First of all, urination, and the second of is reproduction. So for urination, we have a ureter that comes from the kidney. They just transmit the urine from the kidney to the bladder, and the bladder, from the bladder, urethra is there, and the urethra is nothing but passage of urine from bladder, that is the reservoir of urinary system, to outer world through urethral opening, that we have learned in the external genitalia. Okay, so this is the aspect of gynecology also. So urogynecology is the different branch to discuss all these things. But right now, at this point, we are concerned about reproduction. The whole and soul goal of these organs is what? Reproduction. And there are basically two main organs that are involved in this process if we left behind the ovary. So if we count ovary also, then these three, the trio of these three, vagina, uterus and ovary, makes the only organs that required for reproduction in case of gynecology. Now, what do you mean by reproduction? In simple word, you mean making of a baby. It's a reproduction. Making of a baby is simply called reproduction. And for a reproduction, what making of a baby, what we need? We need a female cell, that is ovum. We need a sperm from male. So we got both this ovum and sperm. We also need a site for fertilization. Means we need a site where this ovum and sperm can be there together in close proximity. Okay, only then these people will do the fertilization, when they are in close proximity. And what is the site for fertilization? It is the tube. Fallopian tube, which is a part of uterus, is a site of fertilization. Why it is a site of fertilization? Because this is the only organ where the ovum and sperm can stay in close proximity. Now you understand why fertilization happens in tube. I am very sure that nobody has tell you this point till now. I am telling you right now. Okay, again, now we got a embryo. That means after fertilization of ovum and sperm, what we got is a embryo or a blastocyst. Now we need an organ for development of a baby. What should we expect from that organ? Suppose you are a god and you want to make an organ that only for reproduction, only for making of a baby. What you need from that organ? That organ should be stretchable. That means that the size of the organ, the cavity of the organ should be highly stretchable. For example, from 5 to 10 ml of volume, it converts into 5000 ml of volume. So, my friend, this is not a joke. From 5 ml of cavity, it converts into 5000 ml of cavity. The organ should have a good blood supply, separate and direct arteries from the direct main vessels. So, and from both side of arteries, they need a very good blood supply, which can be increased according to the demand. And when the baby is developed, the the organ that we are discussing should be able to sense this thing, that yes, the baby has been developed, and at that time it should contract also, only at that time. Till the baby is developing inside it, it is not going to contract, but only then it will contract when the baby is developed. Okay, so it can do contractions also, and not a simple contraction, strong contractions. Again, this organ have a direct contact to the outer world through a channel, so that when the baby is developed into it, the baby can go outside of the organ and into the outer world for further life. So only uterus can meet these demands. So that's why the uterus is the main organ for reproduction. Okay. Why the baby develops into uterus? Because it is a stretchable organ. Stretchable doesn't mean the stretchable like stretchable clothes. It it widens its cavity with the time of pregnancy, from 5 to 10 ml of cavity before pregnancy, and at the term pregnancy it is around 5000 ml of volume the cavity has. So it's not a joke. It has a good blood supply through uterine arteries. Both uterine arteries are bigger arteries, are not a smaller arteries, and they become tortuous and widens. And at the term pregnancy, they have a very high blood flow, around 700 ml per minute, of a very good amount of cardiac output per minute. So a good portion of cardiac output. And it has a uterine muscle, smooth muscle, so at the time of labor it contracts, and it has a very strong and good contraction. And the second is, it should be connected to the outer world through vagina. So uterus is connected to the vagina through outer world, from which the baby can go and pass through. So that's why uterus is the main organ of reproduction. So I have some notes of my personal notes which I am going to share you here. Then we will directly go for anatomy. Okay, so let's start with the vagina. Now what is vagina? We already have told you what is vagina. It is a channel which connects the uterus through outer world. It has another function of sexual gratification that has its own advantages of attraction between male and female. But the main function is what? Passing of baby from uterus to outer world. It is a fibromuscular canal connecting the uterine cavity with the exterior at vulva. Okay, so it is just like a fibromuscular tube. It has four walls, two lateral walls, one anterior wall and one posterior wall. So it is a H-shaped cuts or seen on the cut section like this only. Okay, you can see now here. The anterior wall is of 7.5 centimeter and the posterior wall is of 9 centimeter. These measurements are not very accurate and it can vary. See, here is the thing. This is the bladder. This is a rectum. And this, my friend, is the vagina. This one. This is the vagina. And this is, my friend, the uterus. Okay, this is the outer world that connects to the uterine cavity. Now, what is the anterior wall and what is the posterior wall? I am telling you. This is the anterior wall and this is the posterior wall. This is the anterior wall and this is the posterior wall. This is the anterior wall. This is the posterior wall. Okay, so let's go ahead. Cervix separates upper vagina into anterior, posterior and true lateral fornix. Now let me tell you one thing. The cervix is a part of uterus only. Cervix is not a different part. It's a part of uterus only. So if we talk about uterus, so this is uterus and this is cervix. So my friend, this one is cervix and the cervix is embedded into the vagina like this. This is vagina. This is cervix, and as the cervix is embedded into the vaginal cavity, that's why it separates the vagina into two fornices. Four fornices, anterior fornices, posterior fornices and two lateral fornices. In this cut section we can see here two lateral fornices. This is lateral fornices, and if we see in the sagittal section we can see here this is the uterus, this is the cervix, this is the vagina and this is anterior fornix and this one is posterior fornix. So now, what are the relations of vagina? Whenever we talk about anatomy, we always talk about relationship, the made of things, blood supply, nerve supply, like this. So relationship is very important. Anteriorly, the vagina is related to bladder and urethra. Bladder upper 1/3, urethra lower 1/3. So as I have drawn this figure before, this is the vagina. So this is the anterior. So this is the anterior border. Okay, so this is the anterior border and lower two third is made of relation to urethra. This is urethra and upper 1/3 is into relation of the bladder. Okay, now posteriorly the it is related to the rectum, perineal body and pouch of Douglas. We will see in further videos like that. Laterally, it is attached to the McEnroe's ligament. levator ani muscle, bulbocavernous muscle, and vestibular bulb and Bartholin's gland. So these are the lateral relationship of vagina. Now, it has Dordelins bacteria, the normal inhabitant of vagina, in reproductive years. We have discussed this thing in our video, but I will tell you a short uh, introduction how it is happening. See, see, this is vagina. When I talk about reproductive years means the years of woman's life in which she can become pregnant. So, when the time of puberty, which is 11 to 13 years, till the time of menopause, which is around 45 to 55 years, the time between this period is of what? Reproductive years. In reproductive years, the hormones, that female hormones, get dominance. Which are these hormones? Estrogen and progesterone. This estrogen and progesterone play their game in cycles. So during this period, the Dordelins bacteria has natural inhabitant of vagina. What these bacteria do is they convert the glucose into lactic acid. They are anaerobic bacteria. So they make the pH of vagina acidic. And the normal pH is 4.0 to 4.5. Okay, so this is how the Dordelins bacteria work. The epithelium of vagina is stratified squamous epithelium, the same as of skin, but the skin has keratinized stratified squamous epithelium, but vagina has simple stratified squamous epithelium. Just like mouth also has stratified squamous epithelium. Okay, this is the similar to, see, for example, this is man's face. Okay, let me tell you, this is the main face. The man is just speaking someone, or he might be frustrated with his medical studies, I don't know. This is a man. Just imagine, this is a man. So what is the epithelium here? This is a skin. The skin has keratinized stratified squamous epithelium, but when you enter the mouth, the keratinization has been gone. So it is only stratified squamous epithelium in mouth. Similarly, in any cavity, it happens like this only. If we called about vaginal cavity, then also the normal skin around the vaginal opening, it is a squamous, keratinized stratified squamous epithelium. But if you go inside the vagina, it's again stratified squamous epithelium is there. So this is simple concept. Everywhere it applies. In case of urination, or in case of urinary system, transitional epithelium is there, but this we will discuss in further video. Right now you need to understand this concept only. So if we go back to our notes, the Dordelins bacteria are the natural inhabitant, and they keep the pH acidic 4 to 4.5 because they convert the glycogen into lactic acid. They are gram positive rods, and they are anaerobic bacteria. That's why they convert their food into lactic acid with shorter glycolysis. Dordelins bacteria appear at puberty under effect of estrogen and progesterone. The again I talk about the epithelium of vagina. It has different kind of cells, stratified squamous epithelium. During menstruation, the pH goes higher because of mixing of blood with the epithelium. Vaginal epithelium cell change over hormones. We have a separate video. Whenever these cells are there, you can go for this video. Basically, three types of cell are there. In the basal area, there are parabasal cells, which are the very basic cells of vagina without any hormone influence. Whenever there is a progesterone influence, the intermediate cell will be there, and whenever there is a estrogen influence, superficial cells will be there. So this is very easy, whenever the baby is born, the for example, a 5-year old female, you see a very basal layer of vagina without any hormones influence. When this lady or when this female comes into the puberty, under the influence of hormones, first the progesterone, it is the intermediate cell, and then superficial cells under influence of estrogens are there. Okay, so this was all I think about the vagina. One very basic thing we need to understand is a antiversion and anti-flexion. I will make you understand how this is happens. See, suppose this is the vagina. Now if we draw the uterus, I doesn't make simply like that. Okay, I am not making this is a uterus. This is a mid-posed uterus actually, but normally it doesn't happen like that. The uterus and the cervix and the vagina have their own angles. For example, if we talk about the vagina, the angle between the cervix and the vagina is around 90 degree. So if we talk about cervix, so this is around 90 degree. Okay, and this angle is called anti-flexion, sorry, antiversion. V for vagina. Remember, even I forgot this thing. Don't worry. I remember like this, V for vagina. So antiversion is a 90-degree angle, that angle between vagina and cervix. Okay. Now the angle between the main uterine cavity and the cervix is again 120 to 130 degree angles, like this. This is the uterine cavity and this is the cervical line through the cervical length. So again this angle is around 120. So this angle is called anti-flexion. Okay, so again it is simple. Two angles are there, AV and AF. In AV it is a 90, AF is a 120. AF is the angle between cervix and vagina, V for vagina. It is the angle between cervix and uterus. Now what is retroversion? Retroversion means the uterus is just like this. This is the vagina. This is the cervix. Retroversions means the cervix will be like this. Okay, And retroflexion means uterus will be like this. So this is the vagina. If you see this kind of picture, then it is a retroversion, that is here, and retroflexion, that is here. So I hope you understand the retroversion and retroflexion. What about only retroversion and not retroflexion? How we will draw this figure? Simple. Retroversion means the cervix is like this, and if there is a no retroflexion, there is an antiflexion, then what? Again, this angle is the same. So this is retroversion but antiflexion. Okay, so now I hope you understand right now how this terminology happens. So this was all about vagina. We'll talk about uterus in next video. Thank you.